on, world? Hey, what is the deal? You guys already know what today is. Y'all already know what today is. Y'all know what's up. We're doing NCLEX questions today. NCLEX questions today. Hey, so just a quick reminder. Hey, I'm still doing that cardiac medications course or that class. It's live. It's going to be on this coming Sunday, January 14th at 1 p.m. Make sure you guys go over to my website and you guys sign up for that. That link is also in my bio. Hey, welcome. My name is Kevin. I go by the boot nurse. I'm a nurse, been a nurse for 3.5 years. Took the NCLEX multiple times, been in the Navy. I'm sorry, I just got out of the Navy. So I've been in the Navy, was in the Navy for 16 years plus, and now I'm a full-fledged veteran civilian, right? So I want to know who you are, where you're from, and where you're at in your nursing journey, as well as make sure you guys smash that like button, make sure you guys share, make sure you guys follow. Hey, I need 1,000 likes. I need 1,000 likes and I need 100 people in here. If we don't have 1,000 likes, we ain't going nowhere. That's number one. Number two, if I don't have 10,000 likes by the time we get to the 10th question, I'm boycotting the rest. Hey, you better ask somebody. You better ask somebody. You know what I'm saying? So, but of course, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse and you're here rocking out with us, hanging out with us, what do you do? What do you do? I'll give you guys some time. What was that? Was that Wisconsin? No, that's Washington. What is WA? Is that Wisconsin? Washington? It's Washington. Okay, cool. Take my NCLEX on the 12th. Shout out to you. Shout out to you. What else? Who else we got? So we got 100 folks up in here. Hey, I only got 500 likes. Washington State. Okay, yes. I was close. Look, hey, my geography may not be on point all the time, but I will eventually get it. Unless it's like somewhere in Europe, then I'm totally going to fluff it up. So, all right, cool. Hey, we're almost there, y'all. We're almost there. Hey, Kevin. Hey, bye, Kevin. Where you going, Ashley? Where you going? It says from Florida last semester. Maria, prepping for NCLEX. Shout out to you. Hello, pre-nursing. Have 2 classes. Miss Jamaica. Ashley, I see you over there. Hey, we're almost there. Almost there to 1,000 likes. I'm going to call you, bro, to join. I'm going to be right back. Okay. All right, cool. Hey, we're at 1,000 likes. We got 200 plus people in here, 300 people in here. All right, cool. Let's do the damn thing. Hey, you guys already know what we're doing. We're doing NCLEX questions. I got these questions off nurseslabs.com, free sets of questions. Hey, I may be bouncing in between because, I got the AC people here because, it's starting to get cold and I ain't trying to get all cold, breezed out. You know what I'm saying? So make sure you guys like, make sure you guys share, make sure you guys follow. All right, here we go. Question number 1. The nurse is reviewing new orders for a client who has urosepticemia. Which of the following orders should the nurse clarify, select, all that apply? Hey, we have a little exhibit. Let's see what the exhibit looks like. All right. So here we go. So look, here are labs. Here are vital signs, as well as here is our patient's health history, right? So look at this. My potassium, you will get the normal values, potassium, creatinine, so WBCs, BUN, right? Don't ever say bun because it's not a bun. It's blood urea nitrogen. Don't be weird. Okay. So, hey, potassium, look, 6.5. That looks good, right? Sarcasm. Creatinine, that looks good too. Also sarcasm. BUN looks fantastic. Just like WBCs also looks fantastic, right? That's all sarcasm, by the way. Okay. So there's that. And then we have our vital signs. Look at my temperature, my blood pressure, heart rate, respirations, and O2, right? And then this patient has a history of hypertension and chronic kidney failure. What right there could determine, hey, they have chronic kidney failure? Your labs tell you that. Right? So now let's go back to the question. So what is our answer? Do I want to, and this is select all that apply, by the way. So do I want to administer IV therapy or IV antibiotics, ACE inhibitors? Do I want to initiate a continuous cardiac monitoring, obtain a CT scan with contrast of the abdomen, or obtain specimens from blood and urine cultures? All right. I'll give you guys 30 seconds. All right. What are we doing? What are we thinking? BUN and creatinine. All right, cool. Hey, if you guys are new here, welcome. Hey, we're on the road to 10,000 likes. If I don't have 10,000 likes by the time I get to 10th question, I'm boycotting the rest of these questions and y'all are just going to be mad. So yeah, is that 3, 100%. Okay. Remember, this is select all that apply. So it could be 1, it could be a few, or it could be all of them. It's very rare that it's only 1 and it's very rare that it's all of them. All right. Kidneys are bad. No contrast. Okay. WTH. W, T, and H are not the letters that are initiated on here. So 1, 3, and 5. Okay. 5 and 3. Select all. Yeah. SATA. Good old Satan questions. All right, y'all. Let me give y'all 10 more seconds. 1, 3, 4, and 5 from Felicia. Bye, Felicia. All right, y'all. I'm just playing. You can stay. Here we go, y'all. Here we go. Here's our answer. In 3, 2. And the answer is 2 and 4. All right. Here we go. Urosepticemia is a blood infection that originates from the urinary tract. The initial treatment of sepsis focused on the management and prevention of septic shock, mainly by maintaining perfusion and treating the infection. Because ACE inhibitors like lisinopril and ramipril cause the kidneys to retain potassium, the nurse should clarify administration of an ACE inhibitor to a client with chronic kidney disease and hyperkalemia due to the risk of life-threatening arrhythmias. All right. So that's why option 2. And then clients with CKD who have an elevated creatinine are unable to excrete IV contrast due to impaired renal function. Right. The nurse should clarify an order for CT scan with contrast for a client and CKD due to risk of toxicity. All right. So make sure you guys are paying attention. All right. Understand your pathophysiology. Okay. Understand, like, hey, if I got those labs, remember, because it's all about critical thinking in order for you to make a clinical judgment. All right, here we go. Question number 2. The nurse is caring for a client who is receiving sedation and mechanical ventilation. All right, now paint the picture. They're sedated and intubated. So where do you think they are, right? The client coughs and expels the endotracheal tube. Which of the following actions should the nurse take first? So that tube is coming out that throat. What's the very first thing that I want to do? I work CVICU. You throw them on telly. The question was wrong. All right. So here we go. Even if say you throw them on telly, hey, whatever, we're going to see what NCLEX says, right? Which of the following actions should the nurse do first? Do I want to assess the respiratory rate and breathe sounds to ensure adequate ventilation? Activate the emergency response team to manage potential cardiac arrest? Deliver rescue breaths with a bag valve mass resuscitator? And 100% O2, or notify the healthcare provider and prepare for reintubation. What are we thinking? Shout out to all 200 plus of you guys in here. Shout out to all 200 plus in here. All right. Now, I want you to think about this. Let's think about Maslow's, right? Let's think about Maslow's, though. You already have a patient who is currently sedated and they are currently intubated on a mechanical ventilator, right? So they are in your ICU somewhere. And they're going to cough. They cough up and they expel the tube that which supplies oxygen to the body. Now, is there anything do I need to assess, or do I have enough information to where I implement? All right. And you can only pick one. All right. Here we go. I'll give you guys 10 more seconds. Oxygen. You have enough. Okay. All right. All right. Cool. Here we go. Here's our answer. Change the answer. God, here we go. Here's our answer in 3, 2. And the answer is 3. Accidental intubation is a medical emergency. A sedated client is unable to protect their airway and requires immediate reintubation. If a client is accidentally extubated, the nurse should remain with the client, protect their airway using the head tilt, chin lift, or modified jaw thrust maneuver if spinal injury is suspected, and deliver breaths using a bag valve mask resuscitator with 100% O2 until reintubation is achieved. Yes. Hey, there's enough information in the question to tell me I don't need to assess anything. I need to protect my patient's airway. Well, I already know that they don't have an airway. That's why they are intubated. Does that make sense? This is where I tell you have to read the question. All right. And I don't care what you do in the real world. We don't care what you do in the real world. Respiratory, shout out to my respiratory therapist. I love my RTs. I learned a lot about the vents from my RTs. So all my people that are going to be a part of ICU, I'm telling you right now, you better lean and find you a good RT. They're going to teach you everything that you need to know about the vent. All right, here we go. Question number 3. The nurse is assessing a client with suspected preeclampsia. All right, so all my women that have had babies out there, you guys should already know a lot about that, right? Which of the following findings would support the diagnosis of preeclampsia? Select all that apply. So I should have multiple answers right here. So is it anemia, epigastric pain, headache with blurred vision, frequent urination, or proteinuria? What's up, Amber? Hey, if you guys are new here, welcome. We're on the road to 10,000 likes. 10,000 likes by the time I get to 10 questions. We boycotting. I want to know who you are, where you're from, and where you are at on your nursing journey. And if you're not a nurse, what you doing in here hanging out with us? I'll give you guys 15 more seconds. If you guys are new here as well, my name is Kevin. I've been a nurse for 3 years and 7 months now. I've worked ICU a little over a year and 3 months. Then I worked PACU. Then I worked OR. Been working in the OR ever since. Yeah. If you ask me what my favorite place was, it was the PACU. All right, y'all, here we go. Here's our answer. In 3, 2, and the answers are 2, 3, and 5. Preeclampsia is a multi-system disorder that can occur during pregnancy, usually after 20 weeks gestation. It is defined as a new onset hypertension, which is greater than or equal to 140 to 90, 140 over 90 millimeters of mercury, right? And proteinuria, or a sign of end organ damage. Preeclampsia is caused by placental dysfunction that leads to decreased uroplacental perfusion, resulting in inadequate volumes of oxygenated blood to the fetus. The fetus response to inadequate oxygenation is slow growth. So you have fetal growth restriction and preferentially shunting of blood from the periphery, such as the kidneys to the brain, leading to decreased fetal urine output and oligohydroamia. Oh my God. Look, I don't say those words often. No part of me cares what you think. So just letting you know. Additional manifestations of preeclampsia include epigastric or right upper quadrant pain due to hepatic damage and swelling, and headache, blurred vision due to severe hypertension, cerebral edema, and central venous system irritability. All right. So shout out to everybody that got that right. Appreciate y'all. Appreciate all the likes, all the follows. We need all those likes. We need all those follows. That's the trifecta that TikTok likes in order for us to get stuff out there. All right, here we go. Question number 4. The nurse is preparing to administer lithium to a client. Now pay attention. Where does lithium fall under? Like what area of medications? This is pharmacology, right? Which of the following medications should the nurse hold to clarify prior to administering? So this is talking about, medication, combining with other ones, right? So is it hydrochlorothiazide? Is it acetaminophen, sulfathiazine, or metformin? What are we thinking? Shout out to all 300 plus of you guys in here rocking with me. Hey, by the way, y'all, I failed my NCLEX 3 times. No part of me cares. Because guess what? Your test will not determine what type of nurse that you're going to be. I don't give a shit if you've taken it once. I don't give a shit if you've taken it 12 times. You are still going to be a great nurse. You're still going to be a great nurse. That's what that means, right? What's up, Avery? Avery, I see you out there. 10 more seconds, y'all. Number 1, thank you. Alyssa, you're welcome. Because look, I'd be damned if I have somebody tell me I'm going to be a bad nurse just for the fact I may have test anxiety. What's up, Avery? Tell me about it. And the answer is number 1, which is hydrochlorothiazide. Lithium is a mood stimulator or stabilizer most often used to treat bipolar affective disorder. Avery, I'm probably going to miss your answer, so give me a sec. Lithium has a very narrow therapeutic window or index, which is 0.8 to 1.2 milliequivalents per liter. That should be closely monitored. It also has the potential for many drug interactions. Several medications can cause increased lithium levels, including thiazide diuretics like hydrochlorothiazide, NSAIDs, and antidepressants. So shout out to everybody. Avery, what did you do? Hold on. What I miss, Avery? Hold on. Let me go back, y'all. Avery is an OG. I took my NCLEX today and found out I passed. That's what I'm talking about, Miss Lady. Avery, you already know the deal. First of all, you already know I'm going to tell you that I'm super proud of you. All right. I'm going to tell you that I'm super proud of you, and I want you to give one piece of advice to all the people that are in here taking their NCLEX, or they have it coming up, even nursing school, whatever. Give them that advice. Let them know what's going on. Hey, by the way, I'm going to be doing a live e-class that's going to be off of TikTok. All right. That link is in my bio. I'm going to be doing it January 14th, which is this coming Sunday at 1 p.m. We're going to talk about all of the important cardiac medications that you need to know for NCLEX and how to remember them. All right. Hey, it's $10, y'all. $10 and you get to hang out with me over there for an hour and a half, and you get the repeat and all that good stuff, right? So make sure you guys go over there and check that out for yourself. All right. It says, did the NCLEX get harder with the new changes? The NCLEX is just the way that they deliver the questions. That's all. It was definitely the hardest test I ever took. And if you walk out feeling like you failed, everybody feels like they failed. Everybody feels that way. All right, here we go. Question number 5. The nurse in the emergency department is caring for assigned pediatric clients. The nurse should first assess the client who, what? All right, unable to drink or eat without vomiting, has bruising behind the ears after sustaining a sports injury, has a recently placed tympanostomy tube that has fallen out. Has an external fixator and increased pain at the pin insertion site. What are we thinking, y'all? Sorry. Hey, sometimes I don't be getting the answers. I mean, I'll be getting the words right. Hey, I'm a nurse. I'm not a spelling bee champion. The hell y'all think this is? Hey, anyways, I appreciate y'all being here. We're doing NCLEX questions. Got them off. These are off of UWorld, y'all. I'm just letting y'all know. I got these off UWorld. No gatekeeping. That's on the dead homies. You feel me? UWorld. I got them. Anyway, so what is our answer? What are we thinking? What are we thinking? I haven't even touched PEDS yet. Well, you hear, hey, guess what? PEDS is touching you. Pause, but you know what's up. So you're weak. Hey, you got to get stronger out here. UWorld better than Archer? Depends. These are just questions. You tell me if it's better than Archer. I liked Archer better than UWorld, but there's people out here that swear by UWorld. So it all just depends on you and what you like. There's tons of other reviews that are out here, to include mine, the 7-day NCLEX course, which is linked in my bio. Get it for $97 and have it for the rest of your life, however long that may be. Here we go. Here's our answer in 3, 2. And the answer is 2. The answer is number 2. Basilar skull fractures often occur from blunt injury, such as sports injuries or falls, and involves the bones at the base of the skull. Manifestations include bruising behind the ear, such as also known as battle signs, periorbital hematomas or raccoon eyes, and cerebral spinal fluid leakage from the nose or ears. Basilar skull fractures are associated with intracranial injury due to the close proximity of the brainstem or to the brainstem. Therefore, the nurse should assess that client first. All right. That is what you should do. That is the answer. And remember, when you guys are studying, you need content, you need Q&A and rationales. Content, absorb it. Questions and answers, you do them when you do your Q&A, that's how you retain your answers. Okay. Here we go. Or zoom out. Sorry. What you talking about? What you talking about? Hey, if you can't see, I don't know how I can help you, right? Here we go. The question is for number 6. Let me see something. Is that better? Is that better? Y'all let me know. Here we go. The nurse is caring for a client at 38-week gestation who is experiencing contractions, severe abdominal pain, and dark red vaginal bleeding. It would be a priority for the nurse to do what? Better? Okay, good. Number 1, notify the operating room and prepare the client for an emergency cesarean section. Palpate the patient's or the client's abdomen and apply a fetal heart rate monitor. Is to perform a vaginal examination to assess cervical dilation or insert a large bore peripheral venous access device. What are we thinking? So tell me your answer and then tell me what you think this is. This is how you're able to, this is how you're able to critically think to make a clinical judgment. Okay. So you pick your answer and you tell me what it is, right? Based off of what you see in the stem of the question, right? What disease process has severe contractions, severe abdominal pain, and dark red vaginal bleeding? Oh, look at y'all. Look at y'all. 5 more seconds, y'all. Here we go. And 3, 2, and the answer is 2. So it's placental abruption or abruptio placentae occurs when the placenta prematurely detaches from the uterine wall. This life-threatening complication can interrupt fetal oxygen delivery and cause maternal hemorrhage. Associated symptoms may include frequent contractions, abdominal pain, dark red vaginal bleeding, uterine tenderness, and elevated uterine resting tones. Priorities include assessment of maternal vital signs, palpation of the abdomen and uterus, and continuous fetal heart rate monitoring. Okay, and so if monitoring indicates fetal distress and or maternal hemodynamic compromise, the healthcare provider or the healthcare team will prepare for an emergency cesarean section. All right. So think about that. That's part of a management of care question. Like, what do I do? What do I do? Like, what do I do right now? Right. What do I do right now? All right. So think about that. That's painful. Yeah. Here we go. Shout out to everybody that's here. Hey, we're on the road to 20,000 likes, y'all. Let's make it happen. I appreciate everybody being here. Question number 7. The nurse is assessing continuous cardiac monitoring strips for assigned clients. Which of the following findings would require immediate follow-up? So what did I see on the EKG that was just like, hey, bro, help? What is it? Is it AFib? Is it ST segment elevation, first degree heart block, or premature ventricular contractions? Right? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys like, share, and follow. These are all for RNs and LPNs. LPNs, you guys need to realize that you need to know what you can and cannot do and what you can and cannot accept. Once you understand that, you can rock any NCLEX question. It doesn't matter if it's for RNs or LPNs. All right? Could be a STEMI. It could, right? I'll give y'all 10 more seconds. And also, I want to know who you are, where you're from, where you're at in your nursing journey. Also, if you're not a nurse, what are you doing here rocking with us? And I hope y'all are staying warm because, that Arctic blast is coming through the country, y'all. It's coming through the country. 2, MI. All right, cool. Here we go. Shout out to Ghana, high potassium. Okay. All right, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is 2. An ST segment elevation myocardial infarction occurs when at least one of the coronary arteries is completely occluded. The ST segment is the portion of the ECG or EKG, whatever, they're interchangeable, between the QRS complex and the T wave. Prompt treatment is needed to restore myocardial oxygen supply and limit myocardial damage. All right. So that is also another management of care. Like, hey, I need to know what I need to do first. I need to know, hey, I see this. What is it? And then what do I do? What does my critical thinking allow for me to do to make a clinical judgment? Okay. So you have to think about that. All right. It says New Jersey RN MSN. This popped up on my live for you. Shout out to you, Brenda. I'm glad that you're here. Here for fun. I'm an ER nurse. Who is that? I'm an ER nurse already. Been one for 5 years. Shout out to y'all. Shout out to all my nurses that are out there. Hey, by the way, and there we go. There's an example of what our myocardial infarction looks like. With our ST elevation. See, we have our P wave right here, our QRS complex. And then notice we got that elevated ST, right? We call those tombstones. So tombstones, you think death, right? Because the death of the myocardium, right? Think about it like that. All right. Hopefully everybody understands that. If I didn't explain it well, then, All right, here we go. Question number 8. The nurse is caring for a 6-year-old with autism spectrum disorder who is scheduled for a procedure. It would require follow-up if the nurse explains the procedure using pictures, asks the parent to remain at the bedside to provide comfort, holds the client's hand as a soothing measure, or limits the number of staff in the room to ease the client's anxiety. What are we thinking? Like, that's good to know. I can't get ECG to save my life. Well, hey, I could do an ECG class. I could do that. I have an ECG lecture that's part of my course. It hasn't been recorded yet, but I can definitely do one for sure. I'm 47 years an RN, 33 years as an educator and staff. Shout out to you, RJ. Hey, shout out to all my educators out there. Yeah, these are straight from your world. Yeah, I said that. Where were you when I said that? All right, y'all, here we go. Here's our answer. Hey, unlike Steve Harvey and Cedric the Entertainer, I'll tell you where I got them from. Here we go. Here's our answer. Our answer is number 3. It is number 3. Autism spectrum disorder, or ASD, are neurodevelopmental disorders characterized by impaired social interaction and behavior. Each child with ASD has unique communication needs, which the nurse should incorporate into an individualized plan of care. When performing a procedure for a client with ASD, the nurse should engage the following communication techniques to ease the child's anxiety and increase cooperation. Provide brief, concrete, and developmentally appropriate communication or demonstrations explaining each step during the procedure. Children with ASD may respond to pictures as they tend to be visually oriented. Encourage parents to remain near the child to provide comfort and reassurance. Trust me, when you deal with your first patient that has autism, you're going to want that because they know who they are. That is their comfort zone with their parents or their caregiver. Reduce stimulation by limiting the number of staff in the room, and introduce staff or equipment slowly, preferably with the caregiver nearby. All right. Hey, these are the ones that you have to do. I said I got these off UWorld. I don't gatekeep. It's not like I didn't purchase UWorld a long time ago, so I still have it. So why not provide it to y'all? Stop playing with me. If you don't want me to do them, then I won't do them. Okay. I'm still going to do them anyway. But hey, real quick, y'all, I am going to be doing a live need to know cardiac medications class for NCLEX, where we're going to be going over ARBs, ACE inhibitors, beta blockers, calcium channel blockers, DIG, your antiarrhythmic medications, all those good ones. I'm going to be doing that January 14th at 1 p.m. You guys can go over there and check that out. There's the website right there. It's $10, y'all. $10. Come hang out with me for $10. Stop playing games. All right. You spend less hanging out with me than you would like a day at Starbucks. Cause I know most of y'all go to Starbucks at least 4 times a day. Y'all have problems and you need help. All right. Here we go. And that probably go really well with you because you probably need some of those cardiac meds later on in life. Here we go. Are you talking about long COVID or POTS? What are you talking about? I ain't saying nothing. Good point. Yeah, you're right. Boycotting Starbucks? What you mean? Here we go. Question number 9. The nurse is caring for a client with an ascending colostomy, right? Which of the following statements by the client requires follow-up? So what did the client say that is incorrect? As in like, sir, you were wrong. This is the right answer, right? So I avoid eating beans, onions, broccoli, and cauliflower. I change the appliance and bag every other day. I empty the bag when it's about 1/3 full. I try to drink 3 liters of water each day. What are we thinking? Shout out to all 500 plus of y'all. You already know what we're doing. We're doing NCLEX questions. I got them off UWorld verbatim because apparently somebody's just like, you stole them from UWorld. I didn't steal them. I fucking bought them because I paid for that shit. So shout out to y'all who over here want to play games with me. All right. Get this knowledge and stop playing games. Hey, smash that like button. Give me 20,000 likes. Sorry, y'all. I had an energy drink. So, your boy's all over the place. All right. It says 2 weekly unless needed. Okay. All right, cool. Hey, remember, this is perfect world. This is perfect world, NCLEX world, right? So all my nurses that have been working out there, I know y'all got that urge to be like, that ain't right. Hey, I don't care what you think. It's about what the books say. You need my energy? I got you. You already know what's up. Here we go. Here's our answer in 3, 2. And the answer, of course, is number 2. Colostomies may be performed at any part of the colon. So an ascending, transverse, descending, or sigmoid stool becomes more solid as it passes through the colon. So solid drainage characteristics vary with location of ostomies. Ascending colostomies produce semi-liquid stool. Stool is contained in an ostomy appliance bag secured to the skin. The appliance opening is cut to fit closely around the stoma. If the appliance does not fit well, liquid stool may leak onto the periosteal or periosteal. Oh my God, peristomal. Oh my God, peristomal skin and skin irritation occurs due to the digestive enzymes in the stool. Peristomal skin irritation may also occur if the ostomy appliance is removed and changed too frequently. All right, the appliance should be changed every 5 to 10 days. Right, every 5 to 10 days. Somebody said something about 2 weeks. So yeah, about every week to 2 weeks, or if it's 1/3 full, right? So here we go. So shout out to all y'all that got that answer right. Appreciate all the likes, all the follows. Here we go. Question number 10. The nurse in the clinic is reviewing telephone messages from clients previously seen in the facility. The nurse should first telephone the client who had what? This sounds like a management of care. Who do I see first? But instead, who do I call back first? Right? What is an ostomy appliance? I'm not going to lie to you. You might as well just Google it. But essentially, it's that bag that hangs out of the abdomen that collects poop. It's your poop collection bag. Right, and they can be placed in different parts of the abdomen depending on what part of the colon that it's attached to. Okay, but here we go. Is it a lumbar laminectomy with spinal fusion 2 days ago and is reporting straining with bowel movements? A colostomy, a colonoscopy, and a polypectomy 1 day ago and is reporting a small amount of rectal bleeding, and arteriovenous graft inserted 2 days ago and it's reporting temperature of 100.9, or is it a laparoscopic inguinal hernia repair 1 day ago and is reporting difficulty with urination? What are we thinking? I got some 3s and I got some 4s. Shout out to all 500 plus of y'all. Keep smashing that like button, y'all. Hey, we're at question 10. Let's see when we get down a little bit further. We got 4, we got 1. Shout out to everybody that's in here rocking. Make sure you guys keep smashing the like button, sharing, you guys follow. Hey, if you're in nursing school right now, what are you doing? Like, if you're not sharing with somebody, you're greedy. Torn between 3 or 4, give me an answer. Give me an answer. You got to give me one. And here's the thing. If you get it wrong, that's okay. This is what this is for. It's to get you into a routine of learning, okay? Get you into a routine of learning. I don't give a shit about what anybody else in here is saying. You are you, and you take your test alone. So you need to get into your routine. All right. Everybody else needs to get off everybody else's back and start worrying about everybody else and worry about yourself. I'm just saying. That's love, though. Here we go. Here's our answer in 3, 2. And the answer is 3. Arteriovenous graft placement involves surgical connection of an artery and a vein using a synthetic material to graft a hemodialysis access site. Post-operative infection of an AV graft may cause thrombosis, graft failure, and a systemic infection. Fever in a post-operative client may indicate infection of the graft site, which warrants immediate notification to the healthcare provider. This client may require antibiotics and surgical removal of the graft. All right. So shout out to everybody that got that question right. Imagine doing this with your free time. What do you mean, Daniel? I do this on my free time. It says next semester, wish me luck. You got it. Hey, you don't need luck. You got it. You got all, hey, put in the work. Put in the work. All right. And you're going to make it happen. All right.